Hello everyone, and thank you for joining us today for Inlow Medical Center's Healthier You Facebook Live series, where today we're going to give you the heads up on concussions. Children and teens are among those at greatest risk for concussions, which are serious brain injuries that change how the brain functions. Concussions are so common among this age group that 2.5 million high school students reported suffering from at least one concussion in 2017, according to the Centers for Disease Control and Prevention.
Knowing how to recognize these conditions can help young athletes recover quicker and prevent further damage. Hello everyone, I'm Susie Lowry Hall and I'm Inlow's Community Outreach Coordinator, and it is my pleasure to be here today with neurological surgeon Dr. Jeff Lobosky, where today we're going to be talking about the importance of concussions, their symptoms, and how to know when a young athlete is ready to return to play and learn. But before we get started, please remember that the information we're going to share is not intended to be medical advice. If you have questions about your health or your child's, please contact your provider. But as always, feel free to post your comments and questions in the comments field, and we'll do our best to get to them during the broadcast. And with that, we'll get started. So thanks again, Dr. Lobosky, for being here today.
Thank you, Susie. It's a pleasure.
So we'll go ahead and start with what are concussions, and how common are they among our young athletes?
Well, traditionally we thought of concussions, people thought you had to lose consciousness. You had to get knocked out in order to get a concussion. But as we've become more sophisticated, we realize that loss of consciousness is not necessarily a prerequisite to developing a concussion. A concussion is really nothing more than a transient or a brief, for want of a better word, alteration of consciousness.
Okay.
So for that period of time, you would be confused, a little disoriented, maybe amnestic, not remember exactly what happened to you.
Okay.
But you don't necessarily have to lose consciousness. The other thing that's important about concussions is that in order to fit that diagnosis, there cannot be associated neurological deficits, for example, paralysis of an arm or a leg, loss of speech, blindness, things of that nature. Then it gets out of the realm of a concussion.
Okay.
We know that concussions occur when the brain is essentially shifted around inside of that rigid skull. The brain actually floats in a bag of spinal fluid, so it's not fixed. And a concussion results from a deceleration injury, whereas the head hits a stationary object and the skull stops, but that floating brain can bounce back and forth, and that torsion can cause tearing or stretching of important small filaments of the neurons, and it can cause a whole cascade of the release of neurochemical mediators that can lead to the symptoms of concussion. As far as how prevalent it is or how many we've got, the problem is that concussion is underdiagnosed. It occurs much more frequently than we realize.
Okay.
The Center for Disease Control, who you had mentioned earlier, suggests that there's probably up to 5 or 6 million concussions that occur every year, and at least half to 2/3 of those occur in young people, especially young athletes.
Well, that's
significant.
Yeah, it's very significant. So what are the symptoms of a concussion?
Well, in general, the symptoms depend on how severe the initial injury is. One of the symptoms can be a loss of consciousness, but in the absence of that, it's usually heralded by confusion, a state of fogginess. The athlete may not exactly remember what the score is, the team that they are playing, the night of the week.
Okay.
And it may be brief, and he may be even amnestic for the hit that got him there.
Oh, okay.
And so that's one of the things. As time progresses, other symptoms, after the contest is over, you'll find that other symptoms start to become prominent, like headache, drowsiness, sometimes nausea, and even vomiting are very common in a concussion.
Okay. So do concussions always involve like a blow to the head, or?
The majority of them do. I mean, the majority of concussions do involve that, but it's not necessarily so.
Okay.
As I mentioned to you earlier, your brain just floats in this baggie of spinal fluid.
Yeah.
It floats there, and sometimes just a rapid movement of the neck. In other words, if you get tackled and you push your neck back, you can cause that brain to contuse within that skull and start releasing all of these neurotransmitters and neurochemicals that can lead to the symptoms of a concussion. So no, you don't always have to have it, but most of the time it is.
Okay. So when should parents and coaches check for signs and symptoms of a concussion?
Well, that's really important because oftentimes you won't see a difference in the athlete. He'll get hit and he'll get up and go back to the huddle, or he'll get hit, get off the court, and come back and play again.
Okay.
But when a coach or a parent or an athletic trainer sees a significant blow to the head, sees a kid that really got hit, whether he lost consciousness or not, whether he complains of any symptoms or not, that we need to be vigilant about that. In other words, we really need to check those kids, bring them over, and interrogate them. No kid died from being interrogated about having a concussion, but there have been a number of kids and athletes that have died because they weren't interrogated. So we should always err on the side of caution, and if you see a relatively violent blow, or if you see the athlete acting a little strange or odd, walking in a funny manner or not seeming to be his normal self, it's incumbent upon those bystanders to really take these kids aside and at least talk to them a little bit, make sure that they haven't had any other telltale signs of concussion. Because a second injury can be fatal in a very short period of time.
Okay, so so they only do this immediately after the injury, or like you said, they should be on the lookout days later?
Well, you can
time frame?
Yeah. So most of the time, the initial injuries might be very mild.
Okay.
Again, the kid will feel like he got dinged, which is the term that we oftentimes use. But the next morning or later that evening, after the contest is over and all the adrenaline's out of your system, you'll start to see some of these other subtle signs.
Okay.
And these are things like headache, difficulty sleeping, nausea, sometimes vomiting. Dizziness is a very common symptom. And the next morning or for a couple of days thereafter, even in a kid that seemed normal yesterday or didn't report any injury, they're starting to have these strange symptoms, again, telling us that a concussion did occur. And as that progresses, then they can have even more significant symptoms of poor concentration, irritability, and things of that nature, loss of appetite.
Okay, that's good. Okay, so what should coaches or parents do if they suspect their athlete has had a concussion? Do they go straight to the ER, or what do they do? What are the next steps?
Well, that's a good question. I mean, as I told you earlier, most concussions, fortunately, are mild, and they're self-limited. They get better on their own with no treatment. And within 24 to 48 hours, most concussions usually resolve. But there are certain telltale signs that make us a little bit more concerned. So if the patient has a headache, if there was a loss of consciousness, I think all of those patients, if you lose consciousness at the scene, even if it's just transient for 30 seconds or so, that student, that athlete needs to be evaluated in the emergency room. If your headache gets progressively worse, in other words, you may have a mild headache, but if it's getting worse and worse, or if it's being associated with vomiting, those are very worrisome telltale signs that there may be more than a concussion occurring here. They could have an underlying blood clot in the brain and would require immediate attention. So those types of signs should be evaluated. What's really important is that victims of concussion, if they seem normal after the contest, they shouldn't be allowed to go home by themselves. There needs to be a responsible individual who is with them for the evening and till the next morning, so that they can once in a while just go in and check on them, wake them up, make sure they wake up and that they're stable. Because if you let them go home by themselves and things progress, nobody's there to be a witness to that, it can have very deleterious and sometimes even fatal side effects.
Okay, good to know. So can wearing a helmet then prevent concussions? Are there other things that parents, coaches, and young athletes can do to reduce the risk of concussions?
Helmets help. Helmets too, and as you know, I'm a big fan of helmets.
Yes.
But they can't prevent all concussions. Just think about the NFL. So the NFL has expended a large amount of money to develop the most protective, highly technological helmets of any sport.
Yes.
But think of the high number of concussions that are still present in the NFL in players who wear their helmets. So it cannot completely eliminate that. one of the important things is for coaches to be teaching kids not to use that helmet as a weapon. As these helmets have become stronger and more sophisticated, we have found that players are using their helmets to actually drive the impact, and that creates an increased risk of concussion.
Yes.
When we were trying to deal with the early problems of concussions in the NFL some 20, 25 years ago, one of the suggestions was that we return to the use of leather helmets like they had back in the 30s and 40s. And people kind of thought that was really funny. But when you stop and think about it, if you return to the leather helmet, you're going to be much less likely to use that helmet as the driving force of that impact. So I think proper techniques, prevention of spearing, and not using the helmet as a weapon are one of the ways that we can really prevent them. And helmets can help, but not eliminate.
Got it. That's great. Okay, so how long does it take to recover from a concussion? What does the recovery process look like?
Yeah, well, that varies.
Yeah.
It varies on the severity of the concussion. As I told you, most concussions, the patient will be back to normal within 48 hours.
Okay.
All of those symptoms of dizziness and headache, blurring vision, loss of appetite can usually occur within 48 hours. But on the more severe concussions, those symptoms can progress and can last for weeks to even months in the so-called post-concussion syndrome. And these are patients that after their blow, a week later, they're still having headache. They're having trouble sleeping at night. They don't have an appetite. Bright lights, loud noises bother them.
Okay.
They have trouble returning to regular activities. They can't go back to school because they find it difficult to concentrate. Or if it's an adult who's been suffered a concussion from another reason, they find that they can't go back to the workplace because they can't seem to do those jobs. The problem with that is that for years we looked at those individuals and we kind of we thought that was rather spurious, and we thought, well, these are just a bunch of people that are malingering. They're faking this because the kid doesn't want to go to take his math test, or this guy wants another couple of weeks off of work. And yet, as we've done more significant neuropsychological testing of these individuals, we have actually found that they are indeed having major issues, major organic issues that need to be addressed. So instead of simply saying, well, take it easy for a couple of days and return, these are the patients that may require a referral to a physical therapist for some PT or even vestibular therapy to deal with their dizziness. They may need to visit with the speech pathologist and look at some of the cognitive deficits that they have in order to return. Sometimes we have to refer them to neuropsychologists because their depression becomes a very significant problem in the post-concussed patient. And sometimes we use pharmacological agents, especially some of the antidepressants, to try to treat some of these symptoms. Fortunately, most of them do go away on their own with time. So that's a good thing.
Yeah.
But we have to appreciate that can linger and treat patients appropriately.
Yeah. So how would coaches or parents know that their athlete is ready to return to play and or learning? How do we know? So
the American Association of Neurosurgeons, who one of our primary issues is traumatic brain injury, the Brain Injury Consortium and a variety of other agencies have partnered with the governing agencies of high school, collegiate, and professional organizations, and have set a whole new group of guidelines that are standardized that allow athletes to return. We shouldn't have a subjective decision made by a medical provider that says, yeah, you look okay, go back. We need more objective evidence, because what you really want to do before you return that athlete to play is to make sure that their brain has recovered and they don't suffer what's called a second impact injury, which I alluded to earlier, but that's when the brain hasn't fully recovered and they suffer a second impact, because those can not infrequently be fatal, and we want to prevent those. So sending them back too early is a disaster.
Yeah.
And so we've designed these guidelines that does, in a systematic way, takes the athlete and brings them through different steps before the medical provider will allow them to return to play. Now, in the obviously the collegiate and high school levels don't have the same amount of resources that the NFL does. In the NFL, for example, every athlete, spring training or the spring practices open up, every athlete goes through a series of baseline battery tests of cognitive function, of motor function, etc., to have as a baseline. And then during that particular season, if they suffer a concussion, that battery of tests is repeated to make certain that they've returned to baseline before then allowing them to return to play. Again, those resources are more limited on the other levels, so it's not a perfect world. We can't do that with every high school kid in Chico or Corning and do this extensive testing on them. So we compare those kids to norms.
Okay.
One of the problems with that is that, like every other test, the athletes have found a way to game the system. And because the pressure is that they want to get back and play, they really don't believe this is as serious as you say. Many of them do things like try to do poorly on the test beforehand, so that when they do injure themselves, even if they're doing poorly, it follows their baseline, so you let them return to play.
Got it.
So we have to develop a little bit better ways of picking out those specific patients so that we can protect them.
Right, absolutely.
One of the major problems is the pressure that is put up on the medical decision maker, allowing these kids to return. Think about it. If you have the state championship game coming up Saturday night and your quarterback is out with concussion, if an NFL contract or a college scholarship is on the table, there's a lot of pressure from the coach, from the parents, and from the player to get back into the game, because there's a lot on the table, there's a lot at stake.
Right.
But the medical decision maker needs to be strong enough to resist that and put the athlete's health as the number one priority.
Absolutely, I agree. So thank you, Dr. Lobosky. This has all been amazing information and insight. Is there anything else you want to share with us today?
Well, I alluded to our governing organization, the American Association of Neurosurgeons, and more recently we kind of identified concussion because of its underreporting and undertreatment as America's silent epidemic. A lot of these patients are going and putting themselves at risk because, number one, it's not realized that they've had a concussion. Number two, they're not being properly screened in order to return to play or return to learn. So the AANS has asked its members to reach out to communities like ours and try to increase and improve awareness of concussion. And along those lines, what Enloe Hospital is going to be doing locally is to create an actual concussion clinic and serve as a resource for the local colleges and high schools and even our local emergency rooms, so that we can properly evaluate and treat these patients, make sure that they get cleared properly before returning to work or returning to play. And because it's a multidisciplinary clinic, we're going to have all of the different resources, such as physical therapists, speech therapists, etc., all available to make sure that we make them safe and allow them to return to their full potential.
That's outstanding.
We're looking forward to it.
I'm looking forward to it as well. Well, thank you again for being here today. And thank you to all of you for joining us for our Facebook Live. And we look forward to seeing you next month for our next discussion. Take care.